Well, the coronavirus has hit New York especially hard. There are more than 10,000 people who have died there. New York City is really the hotbed for infections in the state. The 5 boroughs alone have seen more than 106,000 cases. Many hospitals there are just struggling to keep up with the influx of patients. For his latest piece, New York Times columnist Nicholas Kristof got rare access inside 2 Bronx hospitals. The Times actually documented his experience with a camera crew. We have to warn you, some of the material you're about to see is very graphic in nature.
Stretchers, row after row. Comatose patients in isolation rooms. Every surface is dangerous, and so is the air, especially during an intubation.
Every day you're thinking, am I going to get really sick? Am I going to be able to recover? Am I going to be one of those young people that, for whatever reason, dies from this?
The history of this pandemic will be remembered not for briefings at the White House, but for the heartache in the hot zone.
Well, for more, I want to bring in Michael Kirby Smith. He's a New York Times video journalist who accompanied Kristof on that report. You know, Michael, it's almost as though these images don't really do justice as to what you experienced and what you saw. Can you just walk me back? When you were there on the front lines of this epidemic, what stands out with you after you've left this hospital?
Thanks, Reena. Thanks for having us. I think that the thing that stands out to me the most is just the sheer numbers of patients that we see coming in. As soon as patients are helped, there's more coming in, and just how overrun the hospitals are, and the emotional toll that that's having for patients, for the hospital staff. It's just an incredible thing to witness, for sure.
Yeah. You know, you mentioned the emotional toll. It's so hard to quantify something like an emotional toll. But I'm just curious, when you were there, could you tell, were there enough resources? Did they have what they needed to deal with the influx?
I mean, I think, in terms of PPE, they did have PPE. I think that the amount it worked for, doctors, nurses, the amount of patients that they were seeing, I don't think that they had the resources, because it's a never-ending flux of patients coming in, and the doctors are, overworked and just trying to do the best they can to save lives.
Yeah, you mentioned how overworked these medical workers are, the doctors and the nurses. We know that Kristof spoke to these doctors and nurses. What was there a consensus? What did they have to say? Did they feel that the federal government was adequately supporting them?
I think there was an expression that there was a lack of preparation, that had the hospitals been more prepared for this, the numbers of deaths that we are seeing would have been less, and there would be, the risk on medical workers would not be as severe. So I think that there was an expression of frustration in that sense.
Is there any sense, Michael, of any optimism when you spoke to the medical staff, the doctors and nurses? Do they believe that there is a light coming at the end of the tunnel?
I don't know. In the time that we were reporting there, I'm not sure that I witnessed a lot of optimism. What I saw the most of was doctors, nurses, hospital staff pleading for people across the United States to look at what's unfolding in New York as an example of what can happen if preparation isn't taken seriously. And I found that, they were pleading for people to listen to the medical community in terms of social distancing and taking that seriously, and to ultimately listen to the advice of the medical community, as well as, scientists and people that are best equipped to advise us.